Next slide. So the goals and objectives for this webinar, we're going to showcase the work of two of our recent PT Excellence Fellows. We're going to discuss the peer review process for the PT Excellence Fellowship. We're going to review the PT Working Group application process, and it's recently been updated, so we're going to make sure you have the most recent information. We're going to talk about creating a compelling research application, present solutions to common barriers to research, and also provide resources that will help you during the application process and tools that can help support your work in this process. Our presenters today that are going to present their work, Lina, PT, PhD candidate. She's a physical therapist and board certified orthopedic specialist, and she works at the National Hemophilia Foundation. And then Laura Fox will present hers, and she's a physical therapist, a board certified pediatric specialist, and she works at the University of Colorado Hemophilia Treatment and Thrombosis Center. Okay, Lina.
You have to unmute yourself, Lina.
Yeah, that would be helpful, wouldn't it be? Thank you so much. See, I've done so many of these and forgetting to unmute myself. Sorry about that. So again, thank you so much for giving me the opportunity to talk about this little study of mine and about where we are now since being given the award and how we are moving on forward. So the title of my study was The Analysis of Lower Extremity Joint Characteristics, Biomechanics, and Neuromuscular Control During Gait in Patients with Hemophilia. And we really wanted to look here at the kinetics and kinematics of the lower extremity, and then in conjunction with the neuromuscular control while people are actually walking. So I'm going to talk a little bit more about what that actually looks like. Next slide, please. So again, the objectives of the study were really to establish in longitudinal comparison of clinical assessments and quantifiable assessments based on joint characteristics of the lower extremity in persons with hemophilia that are experiencing hemophilic arthropathy. So we wanted to look a little bit more in a longitudinal area and look at some of the clinical assessments that we do, and then really moving into more quantifiable functional assessments on top of that. So really moving a little bit away from the more static assessment into a more movement-based assessment. So furthermore, we really wanted to focus here on the analysis and longitudinal comparison of the kinetics of the lower extremity during gait. And then we wanted to also look at a comparison of the kinematics during gait, and then again of neuromotor control, and then really see what the global impact of these are in a longitudinal manner. Next slide, please. So the people that we were looking at were people with hemophilia A or B who have been experiencing hemophilic arthropathy, and they were recruited from some of the hemophilia treatment centers throughout Southern California. We did a power analysis and came to the terms that we need about 26 to 64 subjects to complete the study. So again, we were looking for males 18 to 65 years old, hemophilia A and B. We wanted to have them moderate to severe disease with a history of hemophilic arthropathy. And we were looking specifically here for that to occur in the knees or ankles as we were assessing the lower extremity. We also, and this was something that was put forward by the IRB, wanted them to be on prophylactic factor regime, and they needed to be ambulatory without the use of an assistive device. And that was just driven by the assessment that we were doing, which was not possible to do if people were using an assistive device. And you'll see that in a minute. So we had to exclude people who were on demand factor replacement, mild hemophilia, and those who didn't really have any issues with their joints as well. Next slide, please. So some of the variables that we were really looking at here were quality of life. We also did a joint health assessment with the hemophilia joint health score. We utilized musculoskeletal ultrasound, but here really looking a little bit more at the muscles themselves and at the cross-sectional area of specific muscles that we were then assessing later on in our gait parameters. So we included an EMG activity here of the muscles that are listed here. We also assessed the ground reaction force, temporal and spatial gait parameters, and we completed a 3D joint excursion. All of that sounds a lot, but it's actually a relatively short assessment. So I'll talk through that in a second. So next slide, please. So the ground reaction force is really assessed on a treadmill. So a person is walking on a treadmill, and there are pressure sensors underneath the treadmill. We have over 15,000 in those, and what they are measuring are specific variables to really give us a good calculation of the ground reaction force. So the ground reaction force will be sampled at 100 hertz for 60 seconds. And the variables of interest that we have here are vertical impact peak, so our IP, our active peak, AP, our vertical instantaneous loading rate, VILR, and our vertical average loading rate, so our VALR. So those are very typical parameters that we need to really calculate our ground reaction force. So we chose those in specific, so they are very early on variables that are demonstrated because they have been linked to injuries in the lower extremity. So right now, as current research stands, those are the ones that we want to be collecting. So all of that data will be extracted, and then from there we can analyze that in MATLAB to get us all the variables that we need. Next slide, please. Now we will combine this with our electromyographic activity. So that's essentially an EMG study. So we're assessing when muscles are being activated while a person is walking. So we are doing that in conjunction with the ground reaction force. So our patient is still on that treadmill. They are still walking. While they are walking, we are collecting all the parameters from the treadmill regarding our ground reaction force. And now we are bringing in our EMG on top of that. So there is a process that we need to do before the person gets on the treadmill, which is our MVC testing, so a maximum volitional contraction testing. So for that, we're placing these little electrodes throughout the body on the bellies of each of the muscle. And you can see those electrodes in the picture to the right side. And then the person will go on the treadmill, they will do a little bit of a warm up, then they will come off and they will do an isometric contraction. And we need to set this up to essentially tell the system what muscles we're using and what their maximum contraction is, so that the system is collecting accurate measurements essentially from that. So the person will actually complete 3 of these contractions. They will hold them for 5 seconds each, and then the middle part is being collected. So that's this needs to happen before the person goes on the treadmill for the actual assessment of these. Next slide, please. So the final part in this 3-step process is then our 3D motion analysis. So in addition of the person walking on a treadmill and the treadmill collecting the data for the ground reaction force and the EMG electrodes being placed throughout the lower extremity and collecting all the muscle activation data, now we're bringing in another component here, which is our 3D motion analysis. So there are being additional markers, infrared markers, being placed throughout the lower extremities. So they are being placed in specific spots, which are listed up here, and they will be collected by an infrared camera while the person is walking on that treadmill. And the parameters that we are collecting here are hip flexion, internal rotation, knee flexion and knee valgus angle, as well as trunk flexion. And that will all be combined. And then you can see on the right there, you get these neat little avatars that you might have seen from a biomechanics lab, and a whole lot of data along with this. So that all combined is a really unique way of looking at a more quantifiable functional assessment. Obviously, we don't have big biomechanics labs in our clinics, but it gives us a lot of good understanding of how joints that were damaged by hemophilic arthropathy are actually functioning in real life and what some of the problems are. So it gives us a lot of data there to work with. As of right now, some of these components have been done in hemophilia, but they've never been combined, which is kind of the elegant way of doing biomechanics. So there are a couple of studies that have looked just at this part, the 3D motion analysis. There are some studies that have just looked at the EMG, and there are some that have just looked at ground reaction force. But there has never been a study that actually combined all of these elements together to get a very thorough assessment of the biomechanics of the lower extremity. Next slide, please. So that brings us up, where are we actually? And there is a lot of hiccups. It was a beautiful protocol that we designed with a lot of great ideas. And I really have to thank at this point in time, Dr. Imana Kaf, who is my partner in crime, who's a wonderful biomechanist and coming with a lot of background in this. So my thanks definitely go out to her. And it was a perfect protocol. Now here are our hiccups though, along the way. And we have so far enrolled 2 patients, and then all of these other things happened. So the university, where we have our research lab, decided to do us a favor, but it wasn't a favor in this particular research study, to remodel the lab and give us a bigger lab with more equipment and a better setup, which is nice, but it took away time, right? And we didn't know that this was happening. They kind of did that as a surprise for us, but the construction was delayed, everything was slowed down. And then sadly, in that entire endeavor, some of the equipment got damaged. So then we needed to get new equipment in. It took a long time. We had some issues with that company because they were going out of business. So we had to switch companies, get a whole bunch of new equipment in, get it all set up and working again, which again was another time delay. The other component was that recruitment was really slow. It was really difficult to get patients to commit to come in. We also wanted to collect this data not just once, but we wanted to repeat it again in the middle and after a year. And then COVID happened, right? So last year in March, the university shut down and there's nothing happening. So there's no students on campus except for a couple of labs. There's no research going on. No one who is not affiliated with the university is allowed to put a foot on it. And that will stay for quite a while until essentially our pandemic is over. So as of right now, as of March last year, we're not allowed to have any patients on campus to do any sort of data collection until further notice. So that's where we are at right now. Next slide, please. So thanks again for everyone, and to NHF for supporting me in this endeavor, and to my partner in crime, Dr. Imana Kaf, and I'll move it over to Laura here.
Okay. Can everyone hear me? Thank you, Lina. That was really interesting. And I actually love how different both of our projects are, because it kind of demonstrates that the idea can really be anything, and it can be in many different forms. And so be creative and, you know, jump in there. Okay, so my study is on women and girls with hemophilia, looking at gender-based differences in comprehensive care. And go ahead and advance the slide, please. The objectives for my part of the presentation, I've been tasked to describe my study design and results, to discuss the process of developing a research question and completing a study. This was my first study where I was the principal investigator, so I'll kind of use that as a case study for you guys, and then to share some suggestions for creating a strong fellowship grant application. Advance. Okay. So a lot of times it doesn't have to be a huge process. You can kind of think of your everyday questions that you ask yourself. And that's where my question came from. So why are we doing things this way? What do my patients look like? Who would benefit from the intervention? Would they respond to this new treatment approach? For me, for this study, the question came from a clinical experience where I said, wait a minute, why am I not seeing this patient? So I do have to say that I'm very proud of my HTC and the hemophilia or bleeding disorders community in general for putting a much needed focus on the care of women with bleeding disorders. But for those of you who have been around for a while, you know, it hasn't always been that way. So I had a colleague say to me, you don't need to see that patient, she's just a carrier. And I said, well, wait a minute, what is her factor VIII level? And it turned out that she did have factor VIII deficiency. If she were a male, I would be seeing her automatically. So it just prompted a question of, well, wait a minute, what are we doing for women with low factor levels, and how are we approaching this? Next slide. So as Lina beautifully demonstrated, life happens. So really find your baby when it comes to a research study, because you need to really care about it to see it through. It does require patience and persistence. For me, it was a huge learning process. And you know that the baby on the left is my actual baby, who's 8 years old now. But as we know, sometimes babies need a lot of attention and care, like the baby on the right. And so really think of your project that way. If it's something you love and something you want to see succeed. Next slide. So like I said, for me, it was a learning process. I'd like to say I looked like the model on the left, but a lot of days I looked like the one on the right, just trying to get down the runway. And that's why it's so important to have great mentors supporting you. And I'll talk more about that later, but really, you don't have to do this alone. There are people out there that want to help you succeed. Next slide. So getting a little bit more into the specifics of my study, the aim was to systematically investigate whether gender-based differences in care exist and to describe the current care received by females with hemophilia. So what are we looking at? What is the current state of practice? Specifically, are women being integrated into the comprehensive care model, and is their care equivalent to their male counterparts when accounting for factor level? Next slide. This was a retrospective cross-sectional study utilizing the American Thrombosis and Hemostasis Network's ATHEN data set. For those of you who don't know, HTCs across the country, hundreds submit patient data into this huge database, and then we can utilize that data with permission, of course, to answer research questions. The population I studied were patients with factor VIII or factor IX deficiency using the ATHEN definition of less than 50% factor level of all ages and severities enrolled in ATHEN, and it was a snapshot from April 2016 to April 2018. We used descriptive statistics for the entire sample, but because of the limited number of females with moderate or severe hemophilia, we limited the direct comparisons to mild hemophilia only, using univariate linear and logistic regression analyses and multivariable linear and logistic regression models. Next slide. So this was a retrospective analysis. I wasn't generating any new data. So really what we were doing was just shining a light on what was already there to get a better look at it. And so here's what we saw. A little bit about the patient characteristics. I think what is most notable, if we could click again, I think there's a little green box, there you go. There were only 1,000, a little over 1,000 females included in the entire data sets. This is the whole country, compared to almost 14,000 males. So that's only 7% of the overall sample, which based on some population prevalence estimates, it should be quite a bit higher than that if we're capturing all of our patients in this data set. Next slide. We looked at the distribution of factor level. Again, these direct comparisons are for all mild hemophilia, and women or females did tend to have a higher factor level than males with mild hemophilia, which we did control for in the analyses that we did. Next slide. This figure looks at what age people were diagnosed. For all of these figures, the orange line is for females, the blue line is for males, and the dots are the distribution, like each individual subject. So you can see that females were diagnosed later than males, even at the same factor level. I personally find this really interesting. I know a lot of times when we know that a female child is a carrier, we might recommend that they have their level tested when they're getting close to menses. But I find that curious because the boys with mild hemophilia, we integrate them into comprehensive care pretty much at infancy. So, could we be missing something, or what is the reason that we're doing that? So I think it's just something to think on a little bit more. Next slide. So I will walk you through this one. This one's a little chunky. Again, orange is female, blue is male. On the x-axis, we're looking at factor level, so increasing as we go left to right. In the chart A, we're looking at ATHEN enrollment time by gender. So these are the number of subjects, or the percentage of subjects who were enrolled in ATHEN greater than 2 years. And you can see that females are less likely to be enrolled in ATHEN for greater than 2 years at the same factor level as males. Chart B looks at comprehensive visits by gender. So when we're talking about comprehensive visits, when you enter data into ATHEN, you can choose what type of visit it was, and comprehensive visit is one of the options. And so if the subject had even a single visit categorized as a comprehensive visit in that 2-year time period, then they were counted as being integrated into comprehensive care. So you can see that females are less likely to have had even a single comprehensive care visit than males at the same factor level. For chart C, we looked at the proportion with an unknown medication type. And when we're talking about medication type, or in the Athens data set, they call it factor type, we're talking about, are they using a bypassing agent? Are they using recombinant factor? What kind of product are they using? And one of the options that you can select is actually unknown. So it's not that this was blank, but that unknown had been entered as the answer to that question. And you can see that females are more likely to have unknown as their medication type. And similarly, in chart D, you can select unknown for treatment type. So treatment type would be episodic, prophylactic, how are they using their medication? And females were more likely to have unknown as the answer to that question. Next slide. So in conclusion, some highlights from what we discovered. The proportion of patients at all HTCs who are female is significantly lower than expected based on estimated population prevalence. So even if we use the low end of that estimation, there should have been closer to 4,000 people in the data set. And we, like I said, we had just over 1,000. The care of females with hemophilia differs from that of males with hemophilia. And we just went over some of the ways that it does differ, like age of diagnosis, inclusion into comprehensive care, recording what we know about their treatment. And then determining the precise way in which gender impacts care does warrant further discussion and investigation. So this study, again, shined a spotlight on this information, but it doesn't explain why it is this way. So could it be that there truly is a variability in practice of the care we give to males versus females? Are there some patient self-perceptions and behaviors that are impacting this? Maybe the way we talk to patients and educate them steers the women towards thinking of themselves more as a caregiver for their child with hemophilia than as a patient themselves. Could it be that the care that women are receiving is fairly equivalent to that of their male counterparts, but we're not entering the data into the Athens data set for some reason? And if that's the case, I would say that is still not harmless, because if we're not recording data about these patients, then we're not able to study them and improve the care that they're receiving. Next slide. So I'll try to go quickly through these next few. I was able to do, because I was 1 year before Lina, I was able to sneak in a few things before COVID, poster presentation at the Athens Data Summit in 2019, a poster presentation and a session, a speaking session at the National Hemophilia Foundation Bleeding Disorders Conference in 2019 as well. And again, COVID, lots of unexpected things happened in 2020. That baby is having a rough time and needs a little more attention, but I do care about it and want to see it through. So the manuscript will happen, but it is not ready yet. Next slide. Some quick tips, and I know Laura is going to go into a lot more information about this, just to help with the grant. In my personal experience, mentorship is really critical. You could talk to team members at your HTC if you're part of an HTC. If you're hooked up to an academic institution, you could reach out to colleagues in your institution. If you feel like you don't have anyone around you in your immediate space who can help you, reach out to physical therapists in the bleeding disorders community. This is a super supportive group of therapists. They are very open and excited to help people out. And so I would really encourage you not to hesitate to reach out. There are people that want to help you succeed, and you could collaborate. So maybe you could have a colleague who does have some of these research supports who you could partner with on a project. Make sure you have a clear research question, one that you care about, and then the study can be, pretty complex. It can be very simple, but make sure you communicate clearly what your study design is. Communicate the potential impact of your study, the so what factor. Why is this important? Why does this matter? What could this lead to in the future? And then my bias is that you're not a robot. Bring your voice. If you can communicate why this is so important to you, speak your passion in your application to show that, this really is something you care about and you're going to see it through. Next slide. Just a quick thanks to the team that helped me be successful with this. I never would have been able to do it without them. Dr. Tyler Buckner was my main mentor for the study. Dr. Diane Thornhill, statistician, Julie Smith, professional researcher extraordinaire, Dr. Manko Johnson, of course, NHF and the Physical Therapy Working Group. Thank you for making this possible and for having me here to talk about it. And then AFN, and most importantly, all of the patients who contribute their data so that we can learn more about them and improve care. Okay, and thank all of you for being here. And I think now I'll give it over to Laura Joyner.
Okay, so thank you, Laura. That was great. I'm going to talk about the actual peer review process for the PT Excellence Fellowship Award, what happens, how you would come about applying for this award. Next slide, please. So the NHF will actually send out information over their various media sources, send out a call for a letter of an intent, and then and there's specific requirements for that letter of intent. And at the end of this presentation, I will show you the website where that you can go to, the NHF website that you can go to find all those resources for all those specifics. Those letter of intents are sent back to the NHF, and then members of the PT Working Group Review Committee will review the letter of intent. If it meets all the requirements, as well as if you have included your CV for yourself and your mentor, then the PT Working Group will notify NHF and the candidate will receive an application. The application from NHF will come and you will need to have that completed, and that application will require up to 3 letters of support. That's a really important piece of information to remember, because a lot of times those letters of support can take some time to gather. One of them needs to be from a colleague, one of them needs to be from your HTC, and then one can be from any person that you would like. But there are specific deadlines for all of these components, and a lot of times those letters of support can hold you up in meeting your deadlines. So that is a barrier that I'll talk about shortly. The NHF Excellence Fellowship PowerPoint, that is a resource that I will show at the end of this, has all the logistical details for the letter of intent and also the deadlines. Next slide, please. As far as the application review process from the PT Working Group, the application will be assessed by a review committee. It's made up of at least 3 people from the PT Working Group, and it's reviewed on overall impact, scientific merit, and relevance to the NHF's mission and research priorities. The applications are evaluated individually by the committee members, and then the committee comes together and makes a committee recommendation to the NHF. So if there's a tie or some indecision on the individual members, there is a discussion that is held with the committee, but applications are evaluated individually using a common scoring rubric by the PT Working Group Application Committee. Feedback will be provided to all the applicants, whether you're chosen as the fellowship winner or not. Feedback will be provided to all the applicants in order to, improve your application for the next time, because we encourage them to reapply if they don't get it the first time. Next slide, please. The committee is anonymous to all the candidates that apply. Like I said, it's comprised of at least 3 PT Working Group members. We do score each rubric individually. We do determine recommendations based on all the score and comments, but NHF does have the final recommendation. And then the comments are also sent to NHF for all the candidates. We do try to add a lot of comments to help with the feedback process. Next slide, please. What I really wanted to focus on is the scoring rubric for just a few minutes. And this rubric is also included in that PowerPoint that includes all the logistical details. But in your letter of intent and your application process, your plan for your project, you need to make sure that you answer all these questions, that you really think about the design of your project. Each one of these categories is scored from 1 to 5. And I'll go over these a little bit more in detail, but we do look at significance, approach, innovation, applicant, and environment. And then we base, each candidate gets a score of 1 to 5 on each area, and then a total score for the project. Next slide, please. So, and we do, this is a common scoring rubric that is used among all the fellowship groups, nursing fellowship working group, social work working group, and PT working group, in order to add some consistency to the working groups. But we relate this specifically to physical therapy discipline. So under significance, does this project expand the knowledge of physical therapy facing the bleeding disorder community? Does it address an important problem facing the bleeding disorder community? And does it employ novel concepts or approaches, original or innovative aims, challenge existing paradigms, or develop new methodologies? For example, Laura talked about this in her presentation. It was a problem she questioned in clinic. Why was this happening? Something that she found in her clinical practice that she just questioned why. One of the projects that we evaluated this past cycle was on telehealth. Well, telehealth was definitely a new innovative idea that has come up because of the COVID pandemic. So that is something that was, to be needed further studying. Can physical therapy be provided via telehealth, and how is that going to happen? So one of the projects that we evaluated was about telehealth. So, and it definitely impacted the bleeding disorder community, and it impacted physical therapy. That just needs to be very clear in your description of your project. What is the significance of it, and why you want to study that? Next. Your approach. You need to let the PT working group review committee know that you have thought out how you are going to carry this project out. Do you have clear, realistic, and I say realistic, goals and objectives? When we write goals for our patients, we always want to make sure that they're SMART goals. It's the same thing with these research projects. Make sure you have SMART goals. They're measurable, they're achievable, they're realistic, and that they're timely. Can you meet it in this time frame of a year for this project? Do you have your target population clearly defined? Is the proposed study designed well thought out and able to meet the objectives? Is the recruitment strategy, potential risk, and method for maintaining patient confidentiality described and feasible? Do you have a plan for data analysis? As PTs, in school, we did talk about data analysis, but it may have been a long time ago. That may not be what we do on it. That's not maybe what we don't do on a daily basis. And like Laura said, you use your resources. I know Lina had talked about having a great person there that helped her with her biostatistics or biomechanics. You use your resources. Do you have somebody that is going to help you analyze all that data that's coming in? Are your outcome measures appropriate and valid for your described objectives? You may know what you want to measure, but are you measuring it with the appropriate tool? And if applicable, are the survey tools or questionnaires provided? So let us know that you have thought out all the steps for your approach and have answered all those questions. Next slide, please. Again, innovation. Does it employ novel concepts, approach, or methods? Are the aims original and innovative? Or does it challenge existing paradigms or develop new methodologies or tactics? We don't want to repeat the same old things that have already been studied before. I don't think this is so much a problem in physical therapy research. There's not a whole lot of physical therapy research in the bleeding disorders community. But we want to know that you've really thought about this innovation. You're being innovative in your research questions. And have you anticipated problems and considered alternative strategies and tactics? I don't think anybody could have predicted this year-long shutdown with COVID. But have you thought of other options? If plan A doesn't work, have you thought of other ways that you may be able to carry out your research project? Next slide, please. And then the applicant yourself, discuss a little bit about yourself. Do you have adequate background, knowledge, and research, or do you have someone that can help you complete this project? Both Lina and Laura talked about having someone that was their right-hand person in helping them in their project. Is the work proposed appropriate to the experience of the applicant? If you don't have any experience in, I don't even know, what you're studying. If Laura doesn't have any experience in doing biomechanics, she doesn't need to be doing the biomechanics study that Lina talked about. And is there a plan described to share this information learned and produced by the project? I think that is probably the most important one. The whole point of this research study group and the research arm of NHF and their new mission is to share research, share these ideas, and encourage more people to do research. It doesn't do you any good to do this research project if you're not going to get it out there to our community. Next slide, please. And then environment. Does your HTC support you and will help contribute to the probability of success of your project? That is why one of the letters of the application does have to be from your HTC saying that they support you in this project. Does the project take advantage of a supportive environment and actually use collaborative arrangements? It is highly encouraged also to do collaborative projects or multidisciplinary projects. That is also encouraged as well. Is there evidence of institutional support? And also, is there adequate staffing to support the research projects? Next slide. So those are the scoring things and the questions that we like to look at to make sure that those projects are adequately thought out. And if those questions are answered, then that would help to complete that compelling application for your research project. Now, some of the barriers to completing an application and some of the things that we have seen in the past for previous applicants, and I think the biggest one that is now going to be even more important is not meeting the deadlines. There are specific deadlines that are set by the NHF that are expected to be met. So not meeting the deadlines is a big one. And as I have noted most in the past, it's really hard. The one thing that is really hard to meet sometimes is the letters of support. So be sure to ask your people early to get those in. And just really stay on top of the deadlines. Also, be sure that you are aware of what the requirements are. Use your resources that I'll show you at the end. Use the information on the NHF website. Review that PowerPoint about all the logistics, timeline, the feasibility, the requirements that are what needs to be included, your CV, all the information that needs to be completed for the application. In the abstract, be sure you have an adequate description of your project, which is what I just described in the previous slides that we look at in the scoring rubric. Be sure that you describe your project in detail so that we know, the PT Working Group Review Committee knows how you intend to carry that out. Also, be sure you have a relevant physical therapy project. This is a physical therapy excellence fellowship. So be sure that it is a relevant physical therapy topic and also a relevant bleeding disorder topic. Those are some common barriers that we have seen that have made it difficult in the past, or not an appropriate application for the PT Excellence Fellowship Award. Next slide. Okay, thank you.
Thank you, Laura, and Lina for a fantastic presentation. I think it was full of a lot of very practical information for us that we can all learn from. So before I open it to a Q&A, I just wanted to let you know and remind you that the research department is here to assist you and support you in your endeavors. So we want you to be successful researchers in any field. And so we want to let you know that we are here to assist you in any part of the process, whether it's in the development of a protocol, whether it's the completion of the application. Obviously, we will not do it for you, but we will offer any support that you need to make sure that you are successful in all those steps that Laura so kindly described. The process has been changed. The idea is to make it as transparent and as objective as possible, so that now people have a rubric, which is actually based on the NIH scoring system. And once you submit your applications, it goes through a very clear path, and all the disciplines are the same. They're mostly done within the working groups, NHS working groups, so the nursing, physical therapy, and social worker. But we also have a lot of resources in our website, that in the hemophilia.org research area of our website. So on the left-hand side, you see that this is this is the Physical Therapy Excellence Fellowship. You have, eligibility criteria. You have the most up-to-date dates for the cycles. You have funding details. You have deadline details, which Laura says are key for a successful application, to stay within those. And we recently, thanks to Karina Lopez, my colleague from the research department as well, we just created a video that delineates step by step what the application looks like, what the questions are like, and key points in each of the sections. So again, to help you be as successful as possible. So I hope you take advantage of them. Our email is super easy, research@hemophilia.org. So if you have any questions at any point, please feel free to reach out. I don't know if there are any questions. I don't see any questions in the Q&A. Let me open the chat. Okay, so let me stop my share, because I think that and so that we can go into a couple questions and see if learning pearls from our friends, from our colleagues. So, I think that when people are starting a research project, it can feel overwhelming if you've never done anything like that. I think Lina clearly stated that she seek the help of people who would, Laura says, obviously this is a physical therapy project, but you also have to go within your expertise to try to come up with real good, well-designed research studies. Laura talked about statistician support. So if Laura can start, and then maybe Lina can follow, how did you go about designing that study, and how did you recruit the help from the interdisciplinary team to accomplish it? So if Laura can start first.
Sure. Yeah, I think this is a great question, because I think if I had felt completely ready, maybe I never would have done it. But I thought it really started with having a question that I cared about, something that I really felt needed more attention, and that I wanted to help contribute to that. And so I think defining that first is really helpful. And then identifying someone who could be a mentor to help you work through the process of refining that question into a study design. So I'm very fortunate. I have lots of good support at my center. So one of the hematologists offered to help mentor me through that. And again, I did have access to the statistician. So I talked to Dr. Thornhill. She was available to help with the project. But really, you identify those people, but then you still have to own it. So you got to stay on yourself to, keep doing all the steps in between and then looping back around with those support people to help keep you going. I think that kind of collaboration is really effective and helpful. And also kind of taking it one step at a time. If I had kind of thought of like, oh my gosh, all these things I have to do, it could get very overwhelming quickly. But just saying, okay, the next thing I need to do is this. I'm going to focus on this, get this done, and we're going to come back together. And so that helped a lot as well.
Thank you. How about you, Lina?
I think there's one thing that Laura mentioned that was really important of having a question, like a question that you really care about. That is really the starting point. So for me, from like how to write a protocol and how to set that up, that was a little bit easier because I've gone through so much research training and I've done research before and I've published before, so I've gone through those steps. So from that component, it was probably a little bit easier. For me, it was more of reading a lot of literature that was out there and identifying that gap. That's really how I got to my study of like looking at like, okay, what have people done? How have they tapped around this question that I had? And has anybody researched this before? And that goes a little bit along of what Laura said before, of like not doing the same thing over and over again, but finding that knowledge gap that was presented and really filling that gap. So for me, I found that gap, and then it came more like, okay, but how do I do this actually? I know a little bit and I know some, and I've gone through biomechanics training and I have all of this ortho background, but how do I actually do this with the equipment that I have here? And how do I put all these pieces that I'm thinking about together into a cohesive protocol that's actually achievable? So that's where I reached out to one of our researchers at the university, who's also a physical therapist, but who is also a biomechanist. So her entire PhD is in biomechanics. So we joined forces and it was like, okay, I have this idea and I want to do all of these things, but how do I put them together into a protocol that actually works and is achievable and is not completely overwhelming? And that's where she really came in and helped me streamline that entire protocol. So that was a helpful component there.
Great, thank you. And I see a question in the chat that says, how long did it take you from creating your question to your application? So I guess how long did it take the process from the minute you said, oh, I have a research question, to the moment you said, okay, I'm going to apply for it? And then obviously Lina is still working on her project. COVID is not helping any.
No.
But if Lina can start, then maybe Laura can go late. I mean, talk about like the time frame, the timeline of everything.
So two phases here. So I've had this question for a long time. So I've been involved with joint health and reading a lot of joint health and going to conferences and talking to people who have studied something in this field. So this question has been burning on my mind for quite a while. So it's not something where I just stumbled on and be like, oh, all of a sudden I have a question. It really came out from being involved in this world and always thinking like, oh, maybe somebody should look into this a little bit more. And this is interesting. And why is nobody looking at it from this angle? So it's like a question that developed, and I don't really know where that started. It really developed over time. But then really sitting down, it probably took me, I want to say, a good month to put it together, of really working on it throughout and finding the right people and putting together a protocol and so forth. So I think probably, I'm guesstimating here a little bit, but probably about a month of putting all of that together.
Okay. For me, I would agree that kind of question that sticks with you, or that topic that sticks with you is what happened with me as well. I had been thinking about women with bleeding disorders and why were they not having access to physical therapy care as part of their bleeding disorders care. And so, if there is a topic that kind of sticks with you all the time, that little buzz in the back of your head that you're always thinking about, that's a really good place to start when thinking about what you want to study. As far as the timeline, to be totally transparent, I actually applied for a different grant before this one and did not get it. And I want to tell you guys that because you should keep going. I decided that if I didn't get this one, I was going to go to the go and figure out what the next opportunity would be and try to make this happen because I really cared about it. It might make you feel better to know that for me, that process from like beginning to write my study design to actually being funded was, I think, about a year. So, be patient with yourself if it is taking a while. If it's worth it to you, see it through. It's okay if it takes a little longer than you expected. And then of course, all of us, we've said, with COVID, it interrupted everything. And so, it's okay to have setbacks as long as you have the support in place and the commitment in place to continue forward.
Can I say something, Maria?
I was gonna say Laura has something to say about that. I heard her.
Just to make a comment too about it is a 1-year grant cycle, and because of COVID this year, we did extend our current fellowship recipient for this year. We did extend her project out 6 months because she wasn't able to get her patients in because of COVID. Lina has had extenuating circumstances, so her project has been extended out. So even though the grant cycle is for 1 year, and we do like, NHF does like to see completion within a year project time, just to keep budgetary and make sure that projects don't drag on forever, and to get research out there in publications and presentations and things. There are extenuating circumstances, and you can send information back to the working group or back to the research representatives, and they are very understandable about applying for extensions to your grant cycle. So if people are like, oh my gosh, I have to finish in a year, there are extenuating circumstances, as you saw in Lina's case, and then, now with COVID. So there are difficulties, and that is taken into consideration.
Right.
So along those lines, very
go ahead, Lina.
No,
go ahead.
I just wanted to piggyback on that. So, and because I've gotten such great support and understanding of that, I think that the most important part is to be transparent and be like, this is the situation. Like, I can't collect the data. Like, I had this amazing plan in place, but then this happened and this happened and this happened. So I think the important part is there just being communication and tell people what's going on. And then I think a secondary plan can always be worked out. So just wanted to say that.
I think Lina took the words out of my mouth. Yes, like I started, and I'm going to end with this saying, you absolutely have our support. I think that the most important part is continued communication lines. If we know, where you're stuck, or that you're working hard and you're just not letting it lag for no reason, we're here to support you in any way that we can. We want you guys to be a successful researchers. And Laura did mention in her presentation the idea of that back and forth. We only give one award per cycle, but if you don't get it, the idea is that you get information back as to what was your application lacking, what would make your application a little bit stronger, so that maybe like Laura, maybe you can apply for another grant, or you can apply for NHF grants the next year. You can write a better protocol, or get advice from others who have done something similar to your project, and beef it up a little bit. So it's research. Even the most expert researchers will say it's a learning experience. You fail a lot, but you learn a lot, and every time you get a little bit better. So don't be afraid to try again.
Kelly has a question too. There was another question.
So can you apply for a grant that a project has been already started? I think that it would depend. It would depend, what happened with the project, what happened with the funding source. So I would encourage to reach out to us so that we can sort things out. I'm pretty sure we can work something out. So
I think we have looked at applications with that before, and I think you would just have to be very detailed in your application. Like if you haven't had funding for it before and you've been doing it without funding, or what are your new objectives? Are you going in a different direction? Those types of things. I think you would just have to be very clear in your application and your abstract. Why, is it just a continuation, or are you doing something different? Are you looking at a different objective with it? You want to advance the study a little bit differently. I think there's, different ways that you could go with that.
Yeah, but do reach out. We definitely want to hear from you. Any other questions? I see none in the chat. All right, well, I want to thank Karina for arranging this, for being the man behind the curtain and helping
My
us.
pleasure. My pleasure.
Helping us with all this and coordinating, which is always the hardest part, I think. And Laura, as a representative of the PT working group, thank you for the work you do within the group and the help that you provided during this presentation and throughout the research cycles. And of course, Laura and Lina, with your stellar research proposals and project, your work, I mean, your passion through your work really shone through today, and I wish you luck in your future endeavors. So thanks everyone for being here today, and I wish you luck.
Thank you.
Thanks everyone.
Thank you so much.
Bye-bye.
Thanks, everybody. Bye.